And we provide services such as bone marrow transplant. I'm just going to flip through these a little quick, but there's a lot of different kinds of blood disorders, a lot of different kinds of cancers, and we also have a program for adolescent young adults. Now this kind of service requires a lot of expertise. So one person can't do it all from a physician standpoint. So we actually have now a faculty of 24 individuals, each of whom specialize in one of these kinds of disorders. So we have a number of hematologists, a number of oncologists. We have five people that just dedicate themselves to doing bone marrow transplantation. So we're really able to match the patient with the right kind of physician. And we have another 17 advanced practice nurses who help with all of the care, and they also subspecialize with expertise in these areas. So we feel like we're really able to provide a nice complement of expertise. So when you're traveling to the hospital, every doctor matters. Just wanted to briefly tell you a little bit about some research without going into lots of charts and graphs. We like to develop new experimental therapies. We do testings in the laboratory and then try to bring them to the clinic. And this is sort of a diagram of a number of steps to do that. You can't just carry something from the research lab and inject it into a patient. There's a lot of things that have to go on, and just to give you a sense of some of those requirements. So I started one of these projects in 2001 and had to go through all the regulations, get all these committees, all these acronyms are for different committee approvals, and then finally launched the trial in 2010. So this kind of experimental therapy took a lot to launch, and we had to file a lot of paperwork with agencies like the Food and Drug Administration. So, if any of you would like to read what we were able to send to the Food and Drug Administration, please give me a call. So when your child needs hospital, your clinical trial matters, because that's what's advancing the care for these kids. We have done very well with some kinds of pediatric cancers. Leukemia used to be a death sentence, and now we cure over 85 to 90% of patients. So that's terrific. And that's from all the research that has been done over the last 40 to 50 years. Those patients that do survive, though, often have long-term effects, and there are a number of different kinds of cancers that we still have a very difficult time curing. So we really do need to continue to push the envelope and try new therapies and continue to launch clinical trials. So we've had to build quite an infrastructure to do that. We have an office that's a clinical trials office within our division. This is just some of the people in there. We have now 24 people that specialize in helping the physicians and nurses conduct these clinical trials. We have over 150 patients per year that are enrolled on clinical trials. We have over 100 active clinical trials, over 360 patients who have been in a trial and they're now in follow-up. And we're working on another 30 trials that are currently in the pipeline that we want to launch over the next year or so. And again, these kinds of folks cannot be billed to insurance. These kind of folks have to either be put on grants or they have to be supported by philanthropy or industry contracts. So the price tag of this office currently is about $1.7 million per year. We've been very successful at getting $600,000 of those personnel onto grants from to agencies like the federal government or private foundations, but we still have a ways to go. So bringing up the money, just to show you a couple slides on that real quickly, and then we'll wrap it up. This is a chart. So